Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead.
Thank you, Christine. Good afternoon, everyone. On behalf of all Nova Scotians, I want to offer my condolences to the family of the loved one who passed away at Northwood yesterday. I want to thank those who at Northwood who are doing a tremendous job of continuing to deal with COVID as they provide care and love to the residents of the facility, and I want to thank them for everything they're doing. And now I'll ask Dr. Strang to give us an update.
Thank you, Premier. Good afternoon, everybody. And like the Premier, offer my sympathies and condolences to the family of the individual who passed away recently, most recently at Northwood. We now have 57 Nova Scotians who have died due to COVID-19. An ongoing reminder about the potential serious nature of this virus. We are reporting one new case of COVID-19 today, which brings the total number of confirmed cases in Nova Scotia to 1,045. This new case is associated with the outbreak in Northwood. And so for the first time, we are reporting no new cases outside of Northwood for 2 days in a row. That's good news, continuing our good progress, but we still need to continue to watch that epidemiology unfold over the coming days. But it's certainly a testament to the work that everybody in Nova Scotia has done adhering to public health rules and the work within the healthcare system and folks in public health and our testing colleagues and in the lab and in primary care in our overall strategy. Yesterday, the QE2 lab processed 353 tests. We currently have 8 individuals in hospital, 4 of them in the ICU. 956 people have recovered, and 36,656 Nova Scotians have been tested and received negative results. We continue to have 2 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. One of those is Northwood, their Halifax campus, which has 19 residents and 3 staff still considered to be active cases. Another facility has 1 single resident as an active case. So while we continue to see good signs in our progress, and as we come out of the first wave of COVID-19, it continues to remain important that we detect anybody who may have symptoms of COVID-19, that we test individuals. So again, remind folks that if they have 2 or more, a fever, a new or worsening cough, a headache, runny nose, or sore throat, please, if you have those symptoms, do the online 811 assessment, or if you don't have online ability, phone 811. They'll walk you through any further assessment and testing as necessary. As we have, as we continue to look forward and things look positive, I want people to understand that what our new normal will look like. I know people are really anxious and would love things to get back to they were prior to COVID-19. But until we have high levels of immunity in the population, we have to stay vigilant in fighting this virus. We have to find a new way and adapt to this new normal, which really we need to think about how we live with COVID-19. Our new normal is not 2019. It's today and moving forward, and how we put things in place that we can live with COVID-19, find appropriate balance with controlling the virus while we reopen our society and our economy. That means we have to continue to practice the personal preventive measures, which I'll outline in a minute, as we reopen. And we also need to, as we reopen the economy and our society, we need to have businesses, community settings, care environments that also support the practice of these personal preventive measures. What are those personal preventive measures? That we need to focus on the importance on hygiene. Frequent good hand washing remains a cornerstone. We need to have focus on what we call cough etiquette. So coughing or sneezing into your sleeve helps prevent the virus from spreading around. Not touching your face, especially if you have unwashed hands, because that's how we infect ourselves. We have virus on our hands and we put our hands to our eyes, our nose, our mouth. good cleaning using a disinfectant product, whether it's in public spaces, workplaces, or at our home. Places where hands frequently go need good frequent cleaning with a disinfectant product. We need to continue. Part of our new normal is a different way we interact with each other. Physical distancing will remain is part of our new normal, and so we need to find ways that we interact but maintains that level of physical distancing of 6 feet or more where at all possible. We need to look at things like non-essential travel. The virus is spread around, whether it's locally or globally, by people moving. So a part of our new normal is how we actually limit non-essential travel, whether at an international global level or at a local community level. Closer to home is part of our new normal. We have to understand that if we are unwell, we need to stay home. And I recognize that there are lots and lots of barriers and that many people don't have sick benefits or other reasons why they need to go to work or their kids go to school because they have to go to work. Lots and lots of reasons. So we need to look at this. There's lots of elements to this, but a fundamental principle needs to be that how do we support people that ultimately, if you're unwell, you can stay home until you're feeling better, whether it's school, work, or going out in the community. But certainly when we have choices about whether we can go out or not, if we're not feeling well, we just need to stay home. We need to look at a part of our new normal is how we bring people together in groups, especially large groups. Some of the highest risk kind of settings for spreading COVID-19 and allowing it to spark up again and have a big outbreak is bringing large numbers of people together, especially in indoor environments when they're in close interaction with each other. So our new normal it really has a lot of how we get together socially and for entertainment and other reasons is going to look very different. We need to these measures will need to be in place for the months ahead as we enter into recovery, but it is part of how we live with COVID, find an appropriate level of control that allows us to continue to sustain the recovery of society and the economy. And lastly, I want to talk in detail about masks, because the appropriate use of masks is also part of this, part of these personal protective measures. There's certainly been lots of debate about the general public using masks. The evidence on masks has evolved, and essentially now we're at a place that we weren't several weeks ago because the evidence wasn't there. We weren't clear on the evidence around the ability of people to be asymptomatic spreaders. But now, as science and evidence has evolved, we know that we can say that really that having the public wearing non-medical masks is important, that we focus on non-medical masks, because medical masks need to be preserved for those who are healthcare providers, that when worn properly, non-medical masks can reduce the spread of the virus the same way cough etiquette and hand washing. It's all part of a package. It's important to understand that two things: that wearing a mask doesn't protect you. It protects people around you because it limits any germs or virus that you have if you cough or sneeze, or even if you're breathing. But masks also need to be worn properly. They need to be fitted so they feel comfortable. They allow you to breathe easily, but they need to fit securely over your mouth and nose. And it has to be mouth and nose. I've seen lots of pictures of examples of people, they pull the mask down so it's only over their mouth, it's not over their nose. Or they pull the mask aside. I've seen pictures of people eating or smoking a cigarette, pulling the mask aside. The mask has to be covering nose and mouth and stay there firmly fitted. Otherwise, there's no point in wearing it. Certainly, she needs to be of a material that can be washable and keep its shape. So keep its shape after being washed. So things that are made out of cotton or linen. It's important that people don't share masks. So if you're in a household, everybody should have their individual mask. It's really important if you're wearing a mask that you're not always adjusting. We don't want people to touch their face. So once the mask is on, you got to put it on properly and leave it there. And every time you touch your face, you're actually increasing the risk of maybe infecting yourself. So it's important to understand that masks can be helpful. But it's really important that people don't get a false sense of reassurance and say, well, if I'm wearing my mask, and forget to do all the other things like cough etiquette, like washing your hands, all the cleaning. Masks are part of a package of the personal preventive measures. Masks alone will not prevent the spread of the virus in our communities. The other way to use masks, and this is even more important, if people are sick, and we ask them to stay home if you're feeling unwell, but if you need to go out see a healthcare provider, then it's very important that you wear a mask when you go into that healthcare environment. Right now, and ultimately how strong our recommendation is on masks depends on what the level of virus spread is. So in Nova Scotia, we're at right now that the public health position is that we certainly ask Nova Scotians to consider wearing a mask in places where they are around other people and social distancing cannot be maintained. You don't have to wear a mask when you're out and about in the outdoors and you're not around anybody outside of your household within 6 feet. But if you go to a grocery store and there's certainly the potential, or any other retail environment that you can't maintain that 6 foot distance, and especially when it's indoors, then those are places where you want to consider using a mask. If we get increased spread of our virus at some point down the future, we may actually have a stronger recommendation. But at this time, with the low levels of virus spread, we're asking Nova Scotians to consider using a mask in those specific environments. As we enter into our recovery, there may well be environments, whether it's a personal services environment, so you're going to get your nails done, or you're going to see health care, whether it's from a family doctor or a physiotherapist. They may actually, because of that close face-to-face encounter as they're providing care, we're certainly having expectations of the care providers wearing masks. They may actually require you to wear masks in some of those settings as well. So people need to understand and be prepared for certain settings you may actually be asked to wear a mask. But in other settings, we encourage people to consider doing that with all the information that I've just outlined. On our coronavirus website has a whole section on masks. We would encourage people to go there, and there's a link to the federal government site around with even more detailed information on masks, including how to make homemade masks. So we need to continue to make choices that limit the opportunity for the virus to spread. That is part of our new normal. We're not going back. I've heard this weekend, I was rather frustrated. I heard lots of people saying, oh, the pandemic's over. Wave 1 is coming to an end. That's very different than the pandemic is over. So it's important that we continue to follow the public health rules even as we enter the recovery phase. Because if we don't, we're right back into the beginning that we were 2 months ago. So this is our new normal, and the new normal is very different from what it was in 2019. It's critically important that people understand that, and we all have to take our responsibility of how we continue to take the necessary steps that can continue to protect each other. Even as we enter into the recovery phase, all the environments we go out to are going to look very different from all the reasons I've outlined, but that is part of our new normal. And it's important we start to understand that and recognize that and be prepared for that in the days and weeks to come.
Thank you, Dr. Strang. I couldn't agree with you more. And I want to thank all Nova Scotians for the hard work that they've been doing. And we are making progress. I'm happy to report that the IWK and the Nova Scotia Health Authority will resume day and short stay surgeries and clinics starting Monday of this coming week. Minister Delory and his department will continue to work with our health partners on gradually opening up the healthcare system. And this is a good start. For those of you that had appointments booked, it is our collective hope that you will have them rescheduled in the very near future. And from that, we'll now take questions. Chrissy.
Just a reminder that reporters will get one question and one follow-up in the time that we have for today. First question will go to Mike Gorman with CBC.
Thanks. Dr. Strang, we heard yesterday from the Prime Minister that the no travel clause across the American border remains in place until at least June 21st. And I wonder to what degree you have input amongst your colleagues when it comes to those type of issues. And specifically, if we look at the ferry service between Bar Harbor and Yarmouth, what kind of things would you be looking for as we approach the startup for that service in early July that would make you feel comfortable about that service operating between our province and a state that still has a fairly high rate of COVID cases?
So we have lots of conversation around this at the Special Advisory Committee, all the Chief Medical Officers of Health, including Dr. Tam and others from the federal government, and certainly lots of discussion about both interprovincial and international borders and how where opening those up may fit in to recovery from a public health perspective. We clearly all recognize that of the different epidemiology in the United States, their different approach to controlling COVID is, from a public health perspective, highly problematic. That we could do all the things that we can do to control COVID in our own provinces and territories, but if it's not well controlled to our neighbors to the south, there's a high risk of introduction and continued introduction back into our provinces. And we know from this is where it came from in the start. It came from outside of Canada. And then, so that introduction from countries outside, beyond our national borders, is something we need to continue to pay close attention to, because it could put all our collective efforts within Canada could be seriously at jeopardy if we have substantive risk of reintroduction from outside the country.
Mike, do you have a follow-up?
Yeah, thank you. Premier, in light of what Dr. Strang just said, I wonder, as you're having conversations with the Prime Minister about what will or will not happen at the border, how much leeway do you have to make decisions about what can and cannot happen in Nova Scotia, irrespective of whatever agreements the federal government and the American government might reach?
Well, we'll obviously work closely with the national government and the Prime Minister. He actually spoke to all premiers last week about the extension and what was the feelings of provinces. Everyone had a chance to express their views. And it was pretty much unanimous across the country that that order stay in place. So we were pleased to see that. And then as we see what unfolds between now and the 21st, we'll be determining what's in that order, and then, of course, we would make recommendations from our province as we continue to work with Dr. Strang around the epidemiology, getting a sense of what's happening south of our border. Those kinds of things will play a role into that. And as well, internally inside of Atlantic Canada, what do we look around mobility across our borders, to starting to get a sense of people moving. To me, a good start for Atlantic Canada would be those that own property in other provinces have the ability to go home to their cottages, and whether you live in New Brunswick and own a property here, I think we should start allowing people to those cottages. And the same as I would say to you, for many Nova Scotians who would go to PEI who have cottages there, we do the same thing. And when you arrive, you follow the public health protocols, which is the self-isolate for 14 days.
Next question will go to Global's Alicia Draus.
Thank you. I'm just wondering about, over the past month, twice already, you guys have loosened some of the restrictions, but we're still not in phase one. So given that you've said that it will largely be up to businesses and industries to come forward with their own reopening plans, is the province ever actually going to release any phase plan, or are we just going to see bits and pieces of the economy reopen as industries come up with their own plans that get approved?
We were very clear. We're through a process right now, a phase right now, where step one is making sure that we go out and communicate to organizations that represent businesses across the province, make sure that they understand how to follow public health protocol. We're currently doing follow-up with them now to make sure that they've been communicating that back to their respective association members. And we're ready to open the economy. It will be, the economy will open. It'll be up to business owners to decide if they want to open in the new normal, if they can follow the protocols. But it won't be opening up one aspect of our economy and then weeks later opening up another aspect of our economy. We'll be looking to open up our economy, and that's why we're working very hard to communicate the public health protocols and standards. And the work that Dr. Strang is doing right now means those associations have input on how they believe they can best operate to keep their customers safe, and it would be prudent on our part as we look at those to analyze them and put them through the public health lens to give them clear guidelines on what they can do.
Alicia, do you have a follow-up?
I do. Just kind of talking again on borders, but again, more interprovincial borders. Is there any expectation that this summer that we'll reach a point where Nova Scotians will be allowed to leave the province without having to self-isolate upon return?
I think part of that will be determined what happens with our sister provinces. As you know, and we'll continue to follow the public health protocol. There's been lots of talk about bubbling provinces. You heard PEI in New Brunswick talk about that. I can tell you that on the call with the Atlantic premiers, there was talk about mobility within side of Atlantic Canada, as particularly as I described in my first question to Mike, those who own property in other provinces to be able to go back and forth. But we're all focused on how do we open up our economies, get that activity, and then look at what does the mobility in and around Atlantic Canada look like for the summer months.
Next question will go to Mike McDonald with the Canadian Press.
I have a question for Dr. Strang. Dr. Strang, Nova Scotia is the last province in Canada without a formal plan in place for reopening its economy. Can you tell me what benchmarks do we have to hit before that kind of a formal plan becomes a reality?
So all along, we've said there's three things we need to look at. We have, and I presented a couple of Fridays ago, the national framework based on public health framework that gives the best public health advice to all provinces and territories around recovery strategies. The second piece of that is watching our epidemiology, and from a public health perspective, we clearly need to have. We've made a couple of steps in opening up the outdoors that we really need to watch the epidemiology in each of those steps for a minimum of 2 weeks to do that. The third piece is that, as the Premier just described, we have chosen to do an intensive consultation and have well-developed plans for reopening before we actually make announcements. And so it's putting all those three pieces together, and that's my ongoing discussion on a regular basis with the Premier and his staff about when we're ready to actually come forward with a comprehensive step in a full recovery plan.
Mike, do you have a follow-up?
Yes, I do. Dr. Strang, what do you say to those who would argue that being cautious is important, it's good? We've talked a lot about how there can be another spike, but it would appear that Nova Scotia is moving too slowly when it comes to reopening the economy.
So this is all about balance. We certainly understand that there are significant impacts from the our current public health measures, which were necessary. But all you have to do is look around the world in other countries, like, for instance, Germany, where have opened up much more aggressively. They're already talking and have had to step back and retighten things down. A consistent message that we've heard, that certainly I've heard in the consultations from a number of sectors, is that they'd much rather continue to be tighter for a little while longer to minimize the chance of having to tighten back down once we start to loosen things up. So a slow, cautious approach is what we're hearing from a number of sectors. It certainly is. We have a long-term view of this. We want to do things carefully to minimize the chance of having to tighten back down over the summer months. So that is the approach, and not everybody agrees with that, but over time, I think that will prove to be the most prudent approach.
I think it's also important here. There are those who would suggest that nothing is happening at this moment in time. It couldn't be further from the truth. The reality of it is we chose as a province, before we started announcing dates, to do a lot of work in advance of that with associations who can go out and work with their members to help prepare those members to get open. The day that we are confident enough to open the economy, businesses in this province should be ready to start on day one. And we're going to continue to do that work. We believe it's important, but there are those out there, quite frankly, who criticized from the beginning on some of the steps that we have made about shutting down the economy. There are people who actually have a very different view of how this virus moves across our province. The reality of it is we followed public health, but as we're doing that, we're very mindful of the fact that a lot of private sector individuals, businesses have been impacted in a negative way, and we're working as hard as we can to ensure that once we see this virus has been flattened, that those sectors centers are ready to open. And I want to thank Minister McCullough and the team at the Department of Business, Dr. Strang and his public health teams, and all of those associations who are working to ensure that their businesses are ready to go. So let me reassure all Nova Scotians, we're not waiting to get the go-ahead and then plan the opening. The opening is being planned as we sit here and talk to you about keeping Nova Scotians safe due to public health, and we'll continue to do our approach, which we believe is the most effective and prudent one to deal with the economy of Nova Scotia.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. Mr. Premier, you mentioned that day and short stay clinics will be reopened next week and that other appointments will be rebooked soon. Will that apply to surgeries? We've heard frustration from people who have been waiting for 9 weeks for their procedures.
So this is starting, this will be day and short stay surgeries that'll be starting. Obviously, there's consultation clinics that are part of that. Some would have had those booked prior to the order and the changes that we made around our primary health care facilities. But this is the opening. This will allow us to do, as I say, this day surgery and short stay. At the same time, assuring public health and our healthcare system has the flexibility to respond if something happens where we require a surge of COVID that would require our facilities to be used.
John, do you have a follow-up?
I do. This is for Dr. Strang. When you talk about the new normal for the COVID period, for the era of COVID, I guess, you said that would apply to large gatherings, for instance, concerts, conventions, that sort of thing. What kind of timeline are we looking at here? Will large concerts and conventions be out of the question until next year or even beyond?
So those are the ones in the public health framework. And again, I guess public health is only one perspective of this, but it's events that bring large numbers of people together, especially in an indoor environment, and where you can't respect the social distancing, will always, as long as we have the potential and we have a population where there's low levels of immunity, those are always going to be environments that are high risk for allowing the transmission of COVID-19, and they're high risk because you can have large numbers of people exposed that can spark a significant amount of then transmission back into communities, but can also very quickly, because of the numbers involved, can create a substantive issue for public health follow-up as well as impacts on the healthcare system. So as part of our new normal, until we actually find a way to actually have high levels of immunity, those are always going to be settings and events that we're going to have to think very carefully about exactly what the rules are around those and what decisions are made. We haven't gotten there yet, but anybody in public health globally identifies those as very challenging environments that we need to think very carefully about in this new world of living with COVID.
Next question will go to Olivier Lefebvre with Radio Canada.
Merci. I'm wondering, with the HRM summer camps being cancelled, the main reason given being health restrictions related to social distancing, gatherings. So parents and community organizations are wondering if any other summer camps will be able to operate during the summer and under which circumstances.
So I had a conversation yesterday with my consultation with the recreation community. I have one on Friday with kind of like the cultural community, and both of those, many of their questions are around summer camps for kids, whether they're music, arts, sports, recreation camps. And we've clearly laid out that the kind of parameters are that day summer camps. We certainly see them being able to happen in a modified manner that respects the public health requirements around an appropriate level of safety. I'm also having a conversation with municipalities later this evening. So there's no reason why municipalities, as part of their recreation programming, can't be now looking at making plans to come forward that could be reviewed with them to make sure that we can do day summer camps in a modified way. We still haven't made any final decision around sleepover camps, but we have certainly those are significant risks to those, and we have because those are all licensed or they're inspected, not licensed but inspected by the public health inspectors and Department of Environment. We had communicated to them, all those summer camp operators, that it's highly unlikely that we're going to be having week away sleepover camps this summer.
Olivier, do you have a follow-up?
Sure, thank you. With HRM summer camp being canceled, it means it's almost 15,000 children that won't go to the municipality of Halifax camp. So there will be a lot of demand if summer camps, summer camps can go on. So parents will look for alternative if they can't find a spot. One is hiring a nanny, for example. So I was wondering what options will be available for them for those parents who can't find a spot in a summer camp.
So, we're looking at two things. We're certainly looking at how we safely reopen daycare for younger kids. I would hope maybe that, that I wasn't involved in the decision by HRM to close down their summer camps. They did that like a month ago. I would hope yesterday's conversation and the conversation I'll be having with municipalities tonight may lead them to understand that they could actually have summer camps modified that respect public health requirements. But there's absolutely no reason that municipalities can't plan to have day summer camps in a modified way.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Premier, with borders closed another month, what will the province do to keep small tourism businesses alive?
Well, we're continuing to work with sectors. There'll be some advertising with inside people as we continue to find our way and flattening the curve as our economy starts to open up, encouraging people to have their vacation here in our province. But there's no question tourism will be heavily impacted this year. We know that. We've heard from many of the operators. The federal government made an announcement through ACOA with substantial investment directly targeting at those sectors. But this will be one of those years where we as Nova Scotians hopefully will take some of our potential time that we may have gone to other places to support local tourism operators here in our own province.
Lindsay, do you have a follow-up?
Yes, thank you. Is the $4 billion in tourism revenue by 2024 goal still realistic at this stage, and will this target be readjusted?
Well, listen, we're focused on trying to get our economy reopened to go forward. As you know, the IVNY goals were set by the IVNY Commission. It is our goal over the 10-year period to continue to focus and continue to achieve those targets. Obviously, the pandemic has created some challenges, as it has with our export opportunities, but we're focused on how we safely find our way through this so that when the economy does open, we'll have flattened the curve enough that it'll be able to stay open, and then turn our minds to how do we rebuild a tourism sector and how do we rebuild those export opportunities that we had leading into the pandemic.
Next question will go to Kyle Shaw with The Coast.
Hi. That was interesting yesterday when you guys were talking about why Nova Scotia got hit harder by COVID than the rest of Atlantic Canada. So if we look further west at a couple provinces with about the same or actually even a bit bigger population than Nova Scotia, do either of you have any insight into why we would get more cases in Saskatchewan and Manitoba put together?
I haven't looked in detail. I mean, I think my focus has been primarily on Nova Scotia and involved in national conversations that inform our Nova Scotia response. I think we need to look at a couple of things, though, that neither Saskatchewan or Manitoba have the same type of kind of international arrivals directly that Halifax does. That's a very important point. That our large international airports, Halifax Halifax is one of them, but those two provinces don't have that. And there's other factors as well, but that introduction from international travel was an important trigger for us.
I think it's also to recognize, as we've said many times, Northwood is the largest long-term care facility east of Montreal. We have a good percentage of our positives have a connection to Northwood. To my understanding, neither one of those two provinces have a facility that large. So we're continuing to work to ensure that we work with the partners at Northwood to get that virus out of that facility. But that has certainly has an impact on the positive tests that our province would have seen. And we'll, and I think Dr. Strang is right. The fact that we are the international airport and a lot of snowbirds came back home could have been part of all of that.
Kyle, do you have a follow-up?
Yes, Christy, thanks. And thanks for that answer. Now, digging a little deeper into statistics for Dr. Strang. The province's COVID webpage shows what looks to me like a significant gender divide, where 62% of our patients are women compared to 38% men. But, what do I know? That's why I'm asking you. Do you have any idea what's behind that large gap?
I think that's really, you look at, as the Premier said, a lot of our epidemiology, our numbers have been driven by the significant outbreak in Northwood. We know because of, life expectancy that there's a significantly higher proportion of any long-term care facility are females rather than males. The workforce in long-term care facility, much higher percentage of that are females rather than males. Put those two together, of course, we're going to get a higher percentage of cases overall that are female rather than male.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. This morning the New York Times did a piece on the COVID actually does discriminate, and they were looking at much higher contagion rates among black people in the States and much higher death rates. And Dr. Tam has expressed recently that that's kind of a hole in the data collection in Canada. I'm wondering, is Nova Scotia attempting to collect race data as related to the disease?
So we're not specifically for COVID-19. There's this ongoing discussion about both at a national and provincial level about how we collect, get health data with racial or cultural identifiers. Ultimately, you have to start with individuals being willing to have a racial or a cultural identifier ascribed to their health card, because that's often how we start. We need something that accurately gives that type of information. So those are ongoing discussions that we have. It's not just COVID. It's about how we actually look at all health data and be able to break it down at whether it's by race, culture, socioeconomics, whatever. That we need to continue to do that. Look at that work and how we advance that.
Tim, do you have a follow-up?
I do. There's been what seems to me a hole in the public health advice. Not just here in Nova Scotia, but across the country. And that involves, I hate to bring it up, but spitting. In past disease outbreaks, prohibitions, even making illegal spitting in public, have been high on the agenda. And yet I haven't heard any public health official mentioning it at all during this pandemic. And it's unfortunately a very widespread habit here in Nova Scotia. I'm just wondering if you could address that.
So, again, you can make things legal or illegal. How do you control behaviors like spitting? Ultimately, hopefully, that's a message that is not COVID specific. Spitting in public is just not a good idea. I'm not sure we're going to go to the extent of making that illegal or not. There's nothing that I'm aware of in the epidemiology that's broken it down and how much of a risk factor that is. I'd much rather we focused our messages on the things where there's very clear evidence that there's impact. All the personal protective measures I spent time earlier today on packaging, we know that there's very clear evidence that those are related to disease transmission and that those good practices actually have a substantive impact.
And that's all the time that we have for questions today.
Thank you, Chrissy. I know getting the economy back on track is on many people's minds. It is on mine for sure, and we're working hard with business to get them ready. As I mentioned yesterday, Dr. Strang has to finish his consultation with businesses that were forced to close. Minister McClelland and his team are following up to make sure people understand how to operate with these new guidelines. When I am out for my walks, I see many people walking, self-distancing, enjoying the beautiful sunshine. I also notice that some of the businesses that were not forced to close but chose to close anyway are now reopening again. It's nice to see. And I encourage all of you to support the local coffee shops and lunch places that have found a way to open their doors safely, and those businesses that actually stayed open during the entire period of COVID. But this is just the beginning. As you work hard to follow the protocols to keep cases down, Dr. Strang will monitor how we are flattening the curve, and then our government will decide when it is safe for businesses to open. And if it all goes well, our goal is early June. We just have to continue to be patient and considerate, knowing that public safety will come first.